Hi, Mrs. Smith. Hi, my name is Nikki. I'm your student nurse aide today, and today I'm going to take your pulse, okay, and some vital signs. So I'm going to get started by washing my hands, making sure your wheels are locked, and I'm going to pull your curtain. And I see you got your call light already. Okay, great. And your bed is in a low, safe position. And for this skill, I will be needing to touch you on your wrist. And the part of the wrist that I need to touch you on is below your thumb area, and which I'll show you here on my hand. Right here, so you got a pulse in your thumb. There's an artery there, a major artery called the radial pulse. And right here, if you take 3 fingers and you touch right below the thumb where the thumb ends and meets the wrist, and you put one finger here, another finger next to it, and another finger next to it, very even. So you notice how I have to make my fingers kind of even. And out of one of those fingers, you're going to feel a pulse. Now, it's very important not to be in the middle and not to be on the pinky side, because there is another pulse over there that's called the brachial pulse. But you don't want the brachial pulse, you want the radial pulse for this skill. So radial pulse on the thumb side. Okay, so again, right after, and there's a little groove in there, right in between, and that's kind of where your artery lies. So another thing, you don't want to push too hard, but you don't want to be too soft, so you want to give it a medium push. And you should feel, what you'll feel is a thumping. Thump, thump, thump. Now, sometimes the thumps are very even and regular, and then sometimes you'll get an irregular pulse, which sounds like thump, 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 thump. So it's irregular. That means the heart is beating irregularly. And that's what we're trying to find out. So vital signs are very important for diagnosis and for treatment for the doctor. So it's very important to get it right. So what else we're going to use is the clock. We have to have an analog clock, not a digital clock, because it has to have a second hand. We have to have a second hand, and I personally, especially when it comes test time, I would like to see that people use the 6 or either the 12. So we have to count for a full minute. That means if you start on the 6, with the second hand on the 6, then you'll go all the way, you'll count all the way till the 6 comes up again, and that's a full minute. So you cannot count for 15 seconds and times it by 4, or count for 30 seconds and count and times it by 2. That is not appropriate. Why, you say? Because remember I said they can have an irregular pulse. How can you determine? You don't have a crystal ball to know that after that other 30 seconds if that pulse is going to go irregular. So you can't count those beats. So you have to count it for a full complete minute to know what it is. So we'll wait till it gets to the 6, and then what's going to happen is the examiner is going to be on the other side, and the patient's going to be in the bed, and he is going to cover, or he or she, examiner, will cover their side and their arm so they won't show you where they're placing their hands at. That way it won't be cheating. Alright, so I'm going to place my fingers here, as you can see, and what I'm determining is the thumb. So there should be thumps. Of course, we're not going to get a thump out of this turnip, but that's what we're feeling for, and we're palpating for the thump and the beat. We're going to count each one, even if it goes thump, boom, boom, boom. Another important thing is do not watch the clock, because if you watch the clock, you ultimately are counting the beats on the clock. And so you wait for the full minute, and then whatever you get, your pulse on average pulse is 76, but you want to be between 60 and 100. Okay, and so if you're anything outside of that, or different parameters that the doctor has for that particular patient, you need to report it. Other than that, if it's normal, you just note it and chart it. So afterwards, after I got my pulse, I'm going to wash my hands. I'm going to go back to my measurement form, and I'm going to write down, and let's just say I got a pulse of 76. I'm going to put 76. I'm going to sign my form, and then I'm going to wash my hands again just in case, because you can't wash your hands too much. I'm going to say I'm done with my skill.